Now here is the topic of mitral stenosis. Let's see it a scenario. Female in third trimester brought with a medical emergency marked short of breath, means there is some abnormalities with the heart. Having hemoptysis, maybe of the lungs. Yes, lungs abnormality. Pulse is high, blood pressure is low, neck pains distended. Maybe the right heart failure in which JP is distended and with prominent A wave. Then the apex beat in left sixth intercostal space mean apex beat is also displaced, mean there is hypertrophy of the ventricles, left ventricle. Then there is first and second heart sounds are prominent, mean it's loud, and it shows also abnormality. There is faint long diastolic murmur. In stenosis, it is a mitral stenosis is a diastolic murmur. See here, it is S1, then S2, and as you know, between S2 and S1 there is diastole, so it will shows diastolic murmur on ECG, which increase in intensity. Then there is also bilateral basal crackles, which shows left lung failure. Clinical features is breathlessness, fatigue, palpitations because of AFib, then hemoptysis, lung failure, pulmonary hypertension, loud S1, hemoptysis due to pulmonary congestion, then loud S1 and loud P2, then mid diastolic murmur, then there is opening snap, mitral faces, milar flush. Because there is low cardiac output, then the face will do vasodilations of the vessels to maintain blood, to maintain oxygen. Signs of right heart failure, atrial fibrillation, left ventricular heave due to left ventricular hypertrophy. Cause is rheumatic, maybe calcification. Pathogenesis includes stenosis, fibrosis, calcification, and fusion of the cusps. Normal orifice is 5 centimeters square, and it can be reduced to less than 1 centimeter square. In severe mitral stenosis, patient is remain asymptomatic until there is above 2 centimeters square. There is above 2 centimeters square, patient remain asymptomatic. AFib also present due to dilation of left atrium. Clinical feature is breathlessness, fatigue, then there is edema, ascites, palpitation, hemoptysis, cough, chest pain. The features of heart failure. Then there is thromboembolism due to atrial stasis, in atrial fibrillation, then mitral cases as we discussed. Low cardiac output, then loud first heart sound, mid diastolic murmur, palpitation due to left heart failure, pulmonary edema, infusion also due to features of left heart failure, right ventricular heat, loud P2, pulmonary hypertension. DDs of Miller phase are SLE, hypothyroidism, carcinoid syndrome, cold weather, and polycythemia. Then the complications due to embolic mitral stenosis can cause embolic stroke due to left atrium dilatation and stasis of blood and thrombosis. There are other heart failure, atrial fibrillation, pulmonary hypertension, and enlargement of the heart. There is important features called Ortner syndrome. Hoarseness of voice occurred due to enlargement of the left atrium, which compress recurrent laryngeal nerve. Investigation we do is ECG, chest X-ray, echo, Doppler, and cardiac catheterization. In ECG, we will give right ventricular hypertrophy, tall R waves in V1 to V3. Why we give left right ventricular hypertrophy? Because blood, as mitral are the valve of left side of the heart. As the mitral stenosis, blood pull up in lungs. Because regurgitation, there is increase in blood volume and pressure in left atrium, which increases pressure in lungs and pull up of blood, and right ventricle has to pump with great force, which causes hypertrophy. P mitral or bifid P wave we have to show on chest X-ray. There is enlarged left atrium and appendages, signs of pulmonary congestion and double right heart border. Echo, we give we shows we get thickened valve area, large atrium. On Doppler, we give pulmonary artery pressure, left ventricle function, and cardiac catheterization. We will get mitral stenosis and negligence coronary artery disease. In there is in mitral stenosis there is opening snap and there is mid diastolic murmur. Management includes medical diuretics for congestion and edema, beta blocker to decrease heart rate and cardiac output. Because also it is afibrillation occur, we have to give anticoagulations for afib and embolism, and antiarrhythmic for afib, and antibiotic prophylactic for infective endocarditis and rheumatic fever. Then surgical percutaneous balloon valvoplasty is the treatment of choice. Then give open commissurotomy and mitral valve replacement and valvotomy.